to, and that's okay. So for folks on the call today, we are going to be recording, so you will get that message from Zoom, just so that you know. I believe that recording has started. We'll go ahead and kick it off here. So thank you so much, everybody, for being here. It's wonderful to be able to create these 90-minute virtual communities with folks across campus. So we really thank you for our time. We have some really incredible folks here today to share their expertise, their wisdom, their perspective and insights on this really important topic of addressing trauma here in our community at Ohio State. So thank you so much for being here. This event is called Supporting Students and Colleagues in the Wake of 2020, a trauma-informed approach to our return to campus. It is a partnership between multiple spaces on campus, which we're really proud of and grateful for. So it's a partnership between the unit that I'm a part of, the Office of Diversity and Inclusion Strategic Diversity Planning, Training, and Assessment Unit, led by our wonderful director, Dr. Sarah Childers, who's also on the call doing tech support, and also supported by our wonderful graduate student, Jamila Goodall, who is also here for tech support. You might see their little boxes at the top. It's also a partnership with the Student Life Multicultural Center, the Center for Ethnic Studies, the Student Life Counseling and Consultation Service, and the College of Social Work. So we're very proud to have these incredible partners be a part of creating this event. Through our talks and conversations with each other, we decided that this event needed to be created because trauma has really been at the forefront of many of our minds. From the analyses of the multiple impacts of the pandemic on people in their work life and their study life, and just the way that we develop as human beings, to the impacts of racism and trauma. Trauma has really been centered in conversations in ways perhaps it hasn't been previously in many of our lives. But understanding what trauma is and then how to interact with one another, knowing that it may be present, is not always as clear as the conversations that we might have about it or the headlines that we might see. That's why we decided to invite our really incredible presenter and our panelists to have this discussion with us. And the structure of the event really reflects what we're hoping to achieve with the event, which is sharing a little bit about what trauma is. So making that a little bit clearer to the extent that we can, and talking about what trauma-informed approaches are. How do we interact with each other when we know that trauma might be present? And that's going to be talked about first by our really wonderful presenter, Ariana Gallagher from the Ohio State Wexner Medical Center's Stress, Trauma, and Resilience, or STAR program. And I'll let her introduce herself in a moment. She's going to give us an overview of trauma through a presentation and talk about a trauma-informed approach. And then we'll move into our panel discussion with our really brilliant panelists, and Ariana will join in on that. And to talk about how some of the unique ways that trauma manifests in our students' lives and in our colleagues' lives here at Ohio State, how we can be aware of those and what that can look like. And then we'd really love to take questions from you. All along the way, you can drop questions in the Q&A. That would be really great. If you have any comments or thoughts that you want to drop in the chat, that would be, you're welcome to that. It would be wonderful. But if you could drop any questions in the Q&A, that would be so helpful for us to be able to address those. And then we'll be able to redirect them to our panelists at the end of our time here today. So that's the overall flow of the event. And before I pass it to Ariana, I do want to give a content warning. We are going to be talking about trauma very explicitly today. And because of that, I'd like to give a content warning for the folks with us. This is not an easy topic to talk about. And we know that the things that we talk about here today may be difficult to engage in. So please know that you are welcome to take care of yourself, and we invite you to do so throughout our time here today. If it ever becomes overwhelming in some way or uncomfortable for you, you're welcome to take a step away. If you need to, you can leave. But we hope that if you do take a step away, please return. We'd love to have you as part of the conversation, but whatever you need to do to take care of yourself, you're welcome to do so, and we invite you to do that. So without further ado, I'm going to pass it to Ariana Gallagher, who's going to kick us off talking about some of the foundations of trauma and a trauma-informed approach.
Hi, everyone, and thanks so much. I use she, her pronouns. Typically, I try to populate that in my name, but for whatever reason today, Zoom's not being friendly about that. So I'm going to go ahead and share my screen, and hopefully that part will go okay. It did before. Wonderful. Okay. So welcome, everyone. And I am part of the Stress, Trauma, and Resilience program, or STAR program at OSU Wexner Medical Center. I oversee programming in our Trauma Recovery Center that works with survivors of crime-related trauma when there's been an incident in the last 3 years. So that's primarily my focus within the STAR program. I also assist faculty and staff members when there's been some kind of workplace incident that's difficult to deal with. So we're going to talk this afternoon about understanding stress and trauma and trying to put some context around the conversation and what it is that we're really referring to when we're talking about trauma. So trauma is an event or a series of events or a set of circumstances that it's experienced by an individual as physically or emotionally harmful or life-threatening. And it has some lasting adverse effects on that person's functioning and wellness in different areas. So understand that when we refer to trauma, that can encompass a lot of different types of experiences. So we want to just recognize that different people are going to be impacted by different events throughout their lives in different ways. And we want to honor and respect that. So we also want to talk a little bit about the impact of stress. Stress and trauma are different, but related often. So there are different kinds of stress that we want to just be aware of. And certainly when someone has experienced trauma and then there are additional stressors that are layered on top of that experience, it can then exacerbate some symptoms. So when it comes to stress, there are 3 different kinds that we want to kind of focus on. And the first one is positive stress. And that's the kind of stress that folks go through. And it's maybe a change that someone was looking forward to. Maybe you're starting a new job, or a student is starting a graduate program and they're really excited about it. And there is some stress associated with the changes that come along with that. So we just want to acknowledge that even when folks are experiencing things that are really exciting for them, there's still stress associated with that event. Next, we want to talk about tolerable stress. And tolerable stress is the kind of stress that is kind of short-term, typically manageable with the right supports. And these are the types of things that we might think of as necessary losses or expected outcomes. Maybe not so much those positive changes, but things that most of us at some point in our lives are going to have to experience or encounter. Finally, we have toxic stress. Toxic stress is when we have prolonged activation of that stress response and not enough support or buffers to sort of balance it out over too long a period of time. So as we're talking about a return to campus in the context of COVID-19, many people are experiencing some level of toxic stress related to the pandemic and kind of the expectation for how long we were going to be dealing with the impact of the pandemic versus the reality of that. And a lot of people are feeling really stretched in terms of their resources to be able to cope. I want to pivot now and talk a little bit about adversity in general, and in particular, adverse childhood experiences. So the reason that we're talking about trauma, it really echoes back to a study that was conducted by the CDC and Kaiser Permanente back in 1998 that really took a look at the impact of adverse experiences in childhood on someone's overall health trajectory throughout their lifetime. So the original study involved 17,000 participants. All of them were insured through Kaiser Permanente insurance, and we're going to talk about why that's important here in a moment. But that's a fairly large sample size. And this particular study has been replicated in multiple spaces among very diverse communities. But the original study really took this slice of the population that had this Kaiser Permanente insurance and opted into the survey. Of the folks that were surveyed, 13% of female participants reported having experienced emotional abuse before the age of 18. 27% reported physical abuse, and just under 25% reported that they'd experienced sexual abuse before the age of 18. Male participants, 7.6% reported emotional abuse before the age of 18. Just shy of 30% reported physical abuse, and 16% reported sexual abuse. Now, this first study really did take a look at breaking down participants along a gender binary, and we recognize that that is not reflective of the population as a whole. So we want to acknowledge that as a deficit in that original study. But as I mentioned, the original study that was conducted to sort of take a look at what sorts of experiences folks had during childhood, and then following the health trajectory of these individuals. This has been replicated in many different communities among much more diverse populations with greater differences in income, and the results have been further validated. So we want to just acknowledge that trauma plays a major role in someone's risk factors when it comes to their overall health into adulthood. We also want to acknowledge that trauma is not only present in childhood, and many people experience adversity as they age into adulthood. So this ACE study is a really important building block. It doesn't tell the whole story. But what the study did find is that certain experiences are a major risk factor for the leading causes of illness and death, as well as poor quality of life in the US. So it's really important to understand how some of the worst health and social problems in our nation can arise as a consequence of these adverse experiences. And being able to recognize these connections can really help us figure out how we can respond in an effective way. So let's talk a little bit about what trauma looks like in terms of presentation in an individual. Now, I want to acknowledge that I'm speaking in generalizations, and that this is not a reflection, every single category here is not a reflection of every single trauma survivor. But these are just some things to look for, some things to be aware of. If you encounter them with an individual, it may be an indicator that perhaps trauma is playing some kind of a role in their presentation. So a trauma survivor in general may lack basic trust and safety. It may be difficult to engage with this individual and build rapport and trust. They may have a difficult time managing emotions. So there may be a bit of an emotional roller coaster, what we call emotional lability. They may have a hard time concentrating or remembering things. They may have some trouble with cognition over time. They may also have a hard time communicating. There may be some difficulties in communicating in an assertive way, or even being able to say out loud what it is they're wanting or needing. Some trauma survivors have a really difficult time with authority, particularly if their trauma revolves around negative experiences with authority figures. Some trauma survivors also struggle with a confused sense of justice. And finally, a lot of trauma survivors have a difficult time grieving, and an even more difficult time anticipating a future for themselves. So as you're engaging with someone to talk about, what do you want for your future, you may not have a real compelling answer because they may have a belief that they don't have a future. So as you're thinking through these different elements that may indicate trauma survivorship, we also have to kind of take a look at how some of these elements may be playing a role in our own lives. Because even if we're a well-functioning and professional, in our career and doing very well for ourselves, that doesn't mean that we're necessarily immune or haven't been impacted by certain traumatic events in our own lives. So as we're recognizing these signs and symptoms in others, we also, it's a good idea to be aware that some of these things may be playing a role in our own lives as well. And that kind of insight and awareness can give us some clues around how best we can cope. So some other just indicators, things to keep in mind, some common symptoms that may indicate trauma in our physical bodies. A lot of folks experience pain, things like headaches or backaches, muscle tension and stiffness, may have a hard time sleeping, may notice racing heart, changes in appetite, really vivid dreaming, some changes in weight, increased susceptibility to illness. You find that you're just getting sick more often, decreased libido, all kinds of different physical symptoms that may be an indication that trauma is playing a role in someone's life. There are also some emotional symptoms, things like mood swings, irritability, feeling impatient, feeling easily overwhelmed or misunderstood or guilty or helpless, experiencing a lot of fear, anxiety, or self-doubt. In terms of behaviors, many trauma survivors find themselves wanting to avoid people, places, or things that may trigger some memories of an event that they would rather not relive. There may be a tendency toward isolation, sleeping too much or too little, overreacting to problems. There tends to be some procrastination, displaced anger, or feelings of inadequacy. Some folks may become a little bit obsessive about certain things, or may turn to substances to try to cope. And in terms of cognitive symptoms, again, some of those memory problems, difficulty making decisions, difficulty trusting their own judgment, may demonstrate some impaired judgment or insight, increased negative thoughts, and a lot of racing thoughts. So as you can imagine, somebody that's experiencing the adverse effects of trauma, they've got a lot of discomfort that they're dealing with and trying to sort through in all of these different domains. So just being aware of the different ways that we might be impacted by trauma can, I think, help give us a roadmap for how to be supportive. Because oftentimes, folks that have survived through some kind of traumatic experience get labeled in some pretty negative ways. If what they're experiencing and demonstrating gets misinterpreted by others, they have a tendency to be labeled as aggressive or manipulative, or maybe they'll be seen as an addict. And all of these sort of pejorative terms that label a person as bad. And we want to try to change that perspective. So a trauma-informed approach is really about shifting the paradigm. It's easy to get caught in that cycle of questioning, what is wrong with you? Why are you like this? When we're frustrated and when we don't understand what's going on with a person. But a trauma-informed approach really helps you shift that paradigm more toward, help me understand what happened. How can I help? And it's just a different way of having a conversation with someone that starts from a place of compassion. So as we're talking about how can we support our students and our faculty and our staff with this return to campus conversation, being able to recognize the critical role that compassion plays. So understanding the impact of adverse childhood experiences and trauma that endures into adulthood can help us develop some empathy. Empathy is a really essential ingredient for compassion. So empathy is this complex process that really emphasizes seeing the the situation from the perspective of that other person, not as yourself in that other person's shoes, not how you might respond, but what is that other person's perspective? And it's about building a relationship with that person. So empathy is the first step. The next step is to combine that empathy, that sense of understanding and caring, with an act of kindness. That's really what compassion is all about. So if you are recognizing that someone is struggling, there's some steps that you can take that are responsive and can help support that person. And it's going to follow this acronym LA LA LA. Now, I can't take credit for this. I did not develop this. This is from the chair of our department at the Department of Psychiatry and Behavioral Health, Dr. Luan Fan. This is his creation, but I think it really breaks down some very simple steps that folks can take if they would like to be supportive when someone else is experiencing a crisis. So LA LA LA, the first LA stands for listen and then ask. So the first step really is simply to listen to that other person, resist the urge to fix it, and instead ask some questions. What questions tend to be better than why questions? So for example, what makes you feel that way? What do you think you're going to do? What can I do to help? So those types of questions can be really supportive and help you gain a better understanding of what that other person is going through. The next law stands for love and act. So demonstrate that you care about whatever this person has going on. Listening with compassion and empathy without dismissing or judging reflects love. And that act of being loved, that feeling of being loved, can help someone sort of reach back out for help when they need it. Act means act to keep that person safe. If you suspect that someone is struggling to the point that they might hurt themselves or someone else, it's important that we act, and we want to make sure that we're taking steps to protect that other person. The third law stands for link and advocate. So link means that if you think someone's in danger, call 911. Link them to a national suicide prevention lifeline. It's 1-800-273-TALK. Link them to mental health treatment. And the last step that we can take is to advocate, get informed, get involved, start conversations to reduce the stigma. A lot of people have a fear of reaching out because they're scared that they're going to be judged. And so whatever we can do to break that stigma and make it okay for us to have these conversations out in the open without that stigma and judgment, all the better. So a couple of do's and don'ts. We do want to listen, hear the story, summarize so that you can be sure that you're really understanding what that other person's saying, empathize, hear what's changed or what's unfamiliar. We want to try to understand the struggle or the problem. Understand that all conversation is important. So we want to pay attention not just to what someone is saying, but also to what they're not saying and to what their body's communicating. So we want to pay attention to body language, tone of voice, eye contact, all of these different indicators. We want to limit any potential distractions as we're engaging with someone in this supportive way. We don't want to be distracted by our phones or making a grocery list in our head. We want to be attentive to that person. Make good eye contact and listen for any kind of incongruity between what the person is saying and what they're demonstrating. Now, a couple of don'ts. Some things we want to avoid. We don't want to jump to conclusions. We don't want to judge. We don't want to move to solve the problem before understanding the entire story. Obviously, we're not going to take calls or have discussions with other people if we're providing support to someone. We want to try to avoid closed-ended questions as much as possible. So those are those questions that can be answered with just a one-word answer, yes or no response, unless we really do need a concrete yes or no answer to something. And we don't want to offer our ideas prior to hearing someone else's thoughts. Remember, it's not your job to solve someone else's problem. It's more about facilitating a conversation and trying to understand what's going on with that person and generate some solutions collaboratively whenever possible. So a couple of just key points to remember, some trauma-informed responses. We want to offer respect. We want to make sure that we're demonstrating respect both with our words and with our actions. We want to create safety. So making sure that we're creating environments where other people feel safe to be able to reach out. We want to allow safe space. So if you're in person with someone, how close is close enough? And obviously there are some cultural differences around personal space. Try to bring some awareness to the conversation about how close is too close in physical proximity to someone. And if you are going to be approaching someone in close proximity, keep in mind that touch can be a trigger for a lot of people in terms of some negative memories. And we want to just be respectful and honor that not everybody receives touch as support. So unless you have that relationship with someone that you could offer a hand on their shoulder or offer them a hug, it's probably not appropriate to do that, even if you're trying to be supportive. We do want to announce our intentions, help people understand what happens next. Communicate, make sure that you're remaining calm and that you're able to sort of slow down and explain things in a way that isn't too complicated. Remember that trauma survivors may have a hard time sort of organizing themselves around complex issues. They're having a hard time concentrating and remembering things. So as much as we can break it down simply, the better. When it's safely possible, respond. Make sure that we are doing something with the information that is shared with us, even if it's just to ask that person, what can I do? And the last thing that I just want to mention briefly, it's also really important as we're approaching these conversations with others that we're prioritizing our own self-care. So compassion fatigue is a real risk when we're dealing with our own stressors, and then we're also trying to be a support to others. So compassion fatigue results from long-term exposure to high stress situations without proper access to adequate resources and support. You might find yourself feeling physically and emotionally tired. You might find yourself feeling exhausted and frustrated and feeling a decreased interest in your work. So if you start to recognize some of these elements, that's a cue. That's not to say that, oh my gosh, I have to leave my profession or I'm doing a bad job at my job. That's not the case. It's just an indicator that perhaps we need to take a step back and reevaluate, what do I need right now? What's going to refill my tank? So I'm going to stop there. This last slide gives a little bit of information about how to reach myself or our program director, Ken Yeager. And I'm going to stop sharing my screen and throw things back to our panel.
Thank you so much, Ariana. I mean, covering so much ground so well in such a short period of time. I know I always learn something new about trauma, and I certainly learned a lot of new things in that presentation. And thinking about some of those do's and don'ts, I was thinking about how sometimes we're really ready to do that for other people, but those are certainly some things we can also show ourselves too, and some of those do's and don'ts of how we talk to ourselves. It's not always something that we think about when we think about trauma. So thank you so much for sharing that. So keeping it all in mind, we're going to jump in to our panel conversation with our really wonderful panelists. So I'm going to let everybody introduce themselves, but before they do that, I am going to introduce myself because I forgot to do that at the beginning of our time here together today. I apologize for that. So my name is Sophia Antoine. I know many folks on the call, but my pronouns are she, her, and I am the Diversity, Equity, and Inclusion Education Specialist at the Office of Diversity and Inclusion's Strategic Diversity Planning, Training, and Assessment Unit. So I'm very happy to be here with everybody, but I'm going to let our really brilliant panelists introduce themselves. And so I'll pass it to Brianna, and then we can just keep passing it back and forth.
Hi everyone, my name is Brianna Taylor. I am the program manager in the College of Engineering, so program manager of Inclusive Excellence, and my pronouns are she, her, hers. And I will pass it to Madison.
Hi Tito, Madison Eagle. Hi everyone, my name is Madison Eagle. My pronouns are she, her, hers. I am the intercultural specialist for Women's Student Initiatives in the Student Life Multicultural Center. I am also a practicing therapist in Columbus as my side hustle. And I am also an Indigenous woman, Cherokee and Shawnee. I'll pass it to Shivani.
Hi, everyone. I'm Shivani Edwards, and I'm one of the associate directors at Counseling and Consultation Service within the Office of Student Life, and the director of clinical services. And I also teach part-time over in the College of Social Work. I'm really happy to be here.
So happy to have all of you in this conversation, and Ariana is also going to join us for this conversation as well. Before we jump into some of the questions, wanting to again give that content warning, we're going to be talking about some specific manifestations of trauma as it applies to our community here at OSU. So please, again, feel free to take care of yourself. Your well-being really is most important always. So getting into our first question, this is for everyone, and answer in the order you feel most comfortable, so because it's going out to everybody. Over the past year and a half, probably a little over a year and a half now, how have you used a trauma-informed approach in the work that you do with either students and colleagues, depending on your role?
Well, I can start. I oversee a couple different areas at the hospital at Harding. And obviously at the Trauma Recovery Center, we operate with the default assumption that if someone is coming to our center, they have experienced some form of trauma. And so being able to sort of come with that perspective is really important. The other area of the hospital that I oversee is our partial hospital and intensive outpatient programs at Harding. And we sort of operate with that same assumption that, we don't know what we don't know about a person's story. So let's just operate with these sort of universal precautions around, let's assume that someone might have something in their history that's challenging and that may be impacting how they're presenting in the space. So just sort of leading with that, that empathy and extending kindness, regardless of how someone else is presenting, being respectful and being kind. I think that's really important. And it's important to extend that not just to, in my case, to our patients, but also among colleagues. Because none of us are immune to this stress either.
To piggyback off of that, I actually became a mental health first aider. So the College of Public Health actually offered this certification training, and it was very profound to be able to learn the warning signs and the ways in which we can help our students and faculty and staff that we see in a public health crisis. Or in a mental health crisis. So I think it's important to continue to lead with empathy, but also being vulnerable as well and sharing some of my own personal experiences and the ways in which I can reach students that way. and really just checking in on them. How are you really doing? You know, how is your heart doing today? I'm holding space for students to share their fears and their frustrations. I think that is really important to have that safe space, and to really lead with that empathy, knowing that you truly do care for them as individuals and their health and well-being.
Yes, I think one of the things I kept in mind as a someone in leadership, but also as an instructor at the time that the pandemic started and when we were all moving off campus was recognizing the amount of change that folks, all of us had to go through. So as helpers, we were also experiencing something similar to the folks we're trying to help. And just understanding what those levels of different roles can put on people. And I think going back to Brianna's point of not knowing what's happening for folks is just trying to provide that space, and how everyone, and ask about how everyone was doing, how are they managing the change, understanding that some of the days where folks might be a little more frustrated or maybe the conversations were a little more negative was really more about the emotional content of what they were experiencing at a from a pylon place and as a collective experience. So just kind of keeping that in mind. And I feel like that hasn't stopped because things keep changing, right? We are still, while we're moving forward, it's not the same for everyone. And just trying to recognize that we have a lot of folks in our families who are not eligible for vaccines or different opportunities or have concerns. And so we really don't know where everyone is. And it's just important to sit with each other with uncertainty and change.
With my student-facing role, I always start my student meetings with a check-in and ask them to share what's going on, if they feel comfortable doing so, and also open it up for them to provide peer support to each other and provide resources. So that at least in the last few weeks, it's been like, oh, I'm seeing this great therapist, and then they refer everybody to that therapist, which has been really great. And I'm so glad to provide that space for the students to be able to share resources like that. And it's also really important to build that next level of self-care, which I talk about as community care. And I think that the idea of self-care is a really westernized and individualized concept of we just need to take care of ourselves and worry about me and then I'll be fine. No, we need other humans. We are social beings. We need to be able to point to each other and help lift each other up at any given time. That's how we've survived all these centuries. And so that's really the philosophy that I use in my student support role, cultivating that community of care and support, and also seeing everyone as in their full state, their holistic well-being. So I really utilize the Student Wellness Center's 9 dimensions of wellness and talk about emotional well-being, physical well-being, if you, and also referring back to Maslow's hierarchy of need, which is if you don't have food, if you don't have shelter, like you can't get to that next level of taking care of your emotional well-being, your mental well-being. And so making sure that we have that base level of need taken care of. And then also in the concept of recognizing everyone's whole selves, I think it's really important when we talk about care to also acknowledge the systemic oppression that impacts all of these systems and these experiences of trauma, and recognize that we can't separate care from the systemic oppression that marginalized folks are experiencing.
Yeah, thank you all so much, from talking about this sort of like universal approach to trauma-informed interaction, right, that Ariana was speaking to of, it's probably safe to go the route of understanding or believing that trauma might be present in any interaction that we have. I loved that. And then the specific skill building of the mental health first aid that Brianna mentioned, that I've heard is a fantastic program. To hearing Shivani really name that we're still in a pandemic, and despite behaviors going on around us, we're still in this ever-changing environment, and acknowledging that for one another is really important, from those early days that Shivani was mentioning to right now. And then, Madison, these techniques of allowing peers to be able to have the opportunity to support themselves, whether that's students or staff, faculty, and understanding the systemic components and our social identities and pieces that connect to this is such rich advice for us. So I thank you for that. And wanting to dig in a little bit deeper, we'll start with talking with Maddie first, but then any panelists, because I know all of us here work with students, can feel free to respond and would love to hear from you. I'm thinking about that student experience. How have you observed trauma impacting the student experience here at Ohio State?
Yeah, I think that trauma piece, not only for the past year with the pandemic, with the racial injustice, with all of these complex issues that we are living through, they're wrestling with their own personal issues, their own concept of who they are as a person as they come to college, and as they kind of grow out their experiences and figure out who they are, both on a personality level and also their own identity development and social identity development. So a lot of what students have been coming to me for is resources and wanting a solution to these really heavy issues that they're facing. Well, the recommendation for a lot of people is to go to therapy. Well, some people might not have good experiences with therapy, or they might not know how to navigate the process of even getting to a therapist. How does my insurance work? All these issues. And so I really approach it in there's not one size fits all. What works for one person might not work for another person. And it's just about trying to provide resources and get people connected with what would be best for them.
One of the biggest challenges that I've seen is just isolation amongst students. They're really trying to isolate themselves from society for whatever reason, sometimes for a multitude of reasons. And so sometimes they're doing self-sabotage or self-harm because they don't feel valued, they don't feel heard, they don't feel seen or important. So I think that is where I try to be more proactive with some students. Some students that I know who might necessarily not check in as often, I'm checking in with them, right? I'm calling or emailing them, or saying, hey, can you stop by my office, just to check in with them, to make sure that their overall health and well-being is important, and for them to know that they're not alone. I think that's the biggest piece, specifically with the dual pandemics that we're facing. A lot of students feel that they're isolated and that they're not important. So I want to make sure that they know that they do matter, their voices matter, and they deserve to be heard. And I sometimes try to be that sounding board for students as well, because ultimately navigating at a predominantly white institution, it's challenging for them to hear themselves, for them to be heard, for them to be seen, and to take up space. So I try to give them that vulnerability and that safe space to do so.
I think some of the things that we are noticing with our students is developmental differences. So the graduate student experience was quite different than our two classes of undergraduate students who may be coming to campus for the first time, who are thinking about student orgs in person. Last year, they had less choices to navigate. There are more decisions to be made. So I think going back to Ariana's, PowerPoint around difficulty with decision making and considering options, let alone cultural changes, it can be very different. Students who may have benefited from being at home with more supports in the last year and a half are one group of folks. There are other students where that was not a positive experience, and rather may have been either more trauma compounding or new trauma. And that is just, I think that the sense that we're getting is that everyone's carrying a lot with them as they're also trying to navigate academic stress.
Yeah, I love what everybody has been saying. I also teach in the College of Social Work, and I agree that students have been really struggling with all of the changes and the pivots back and forth, and we're going in person, but it might become hybrid, but it might, we're going to have this time frame. Nope, just kidding. It's this now. And it's a lot to keep track of. A lot of students are really struggling with staying organized and being able to keep track of all their different responsibilities. And everybody's got kind of different resources in terms of what's available to them on an individual level. And so as Shivani was saying, some folks that were remote students last year, that was a really positive experience because they had access to a lot of support. And for others, that was a really negative experience because the support that they would have otherwise been able to access on campus wasn't available to them, and they didn't personally have a lot of individual support. And so just being able to honor that people are coming from different places. And we have a specific sort of track of treatment in our partial hospital and intensive outpatient programs at Harding that's targeted toward young adults, sort of 18 to 24 years old. We see a lot of students in those programs. And what we notice as a common theme for a lot of folks that are really struggling is a lack of cognitive flexibility, that the world has been really polarized, and it's really difficult then to help someone develop cognitive flexibility, being able to go from this sort of all or nothing place to a place where multiple realities can exist at one time. And that, we don't have to be perfect in order to be adequate, but what does that mean? And how do we approach some of these decisions when maybe there's not an ideal solution on the horizon? How do we choose between perhaps some items that none of it's going to get us exactly where we want to be, or at least not right away? And so I would also say that a lot of folks are reaching the limit of their distress tolerance. And, maybe they've done a really great job of coping for, 17 months. And now they're just sort of like, oh, I've had it. One more little stressful thing is that straw that broke the camel's back. So I think that's what I'm noticing more than anything else.
Thank you so much for those reflections, everyone. It's so enriching to hear the perspectives of how everybody interacts with students in different spaces, but we have sort of overlapping and then also discrete ways and observations that we're making of how trauma impacts that student experience, and really thinking to what Shivani and Ariana was sharing was this idea of flexibility, and that flexibility a lot of times it was communicated and, you know, through the media, and this idea of like this need for flexibility at this time. It was talked about, I think, a lot easier than it actually is to be flexible, and contextualizing that flexibility within this phenomenon of trauma. I really appreciated that, and that's a perspective that I hadn't thought of. So thank you all so much for sharing. And I think that that component of flexibility certainly impacts our students as it does our staff and faculty. So employees here at the university and our colleagues, and for us, and then also superiors for students, in that hierarchy. I'm wanting to pivot to Shivani first, and then again, all panelists are invited to respond. But thinking to that staff experience, Shivani, what are some of the employee experiences? So that would be faculty, staff, with trauma or distress that you have observed, and what can faculty and staff do to support one another during this time? What are your suggestions?
Thanks for that question. I think what we've noticed over the past year and a half is, again, in our different roles at the university, we are also instructors and mentors and role models for other people. And one of the things that I noticed was almost caregiver stress. That started to pop up, and we often are talking with faculty and staff who are very worried about students who might have missed a class, who may have sometimes have written or expressed some concerning feelings or experiences. But there's more of this, I just want everybody to be okay. And then that kind of anxiety and worry just compounds all of us. And then we want to add the different roles that people have, which may be caregivers to parents, relatives, to children, to all of those people at once in the middle of a pandemic. Families have lost loved ones, have lost employment. And so grief and loss also being a theme for staff. And I think how it comes across is maybe this extra worry that may not have been there a couple of years ago with the same situation, with the same type of student, but it feels far more overwhelming. And we definitely would encourage folks to utilize resources like the REACH program and utilize mental health first aid. Those are some great opportunities to provide some immediate support and then get students to the resources. I think other aspects of stress that we haven't, we did touch on experiences for students of color, international students, our Asian students who, and faculty who have experienced a lot of microaggressions and micro assaults over the past year and a half, as well as just trying to manage the fear from illness. It's a much different day if somebody sneezes right in your vicinity. Don't think much of it 2 years ago. However, now there is more concern. How's this going to impact each individual person? So that is a lot to try to consider. And I think it's important to be able to support staff. And how are you doing today? Where are you at? What would you like to see happen? I think that's a question that has been helpful in talking with faculty and staff who are specifically concerned about a student. because I also want to make sure that what their expectation is going to be something that we can talk about realistically, and also create some space to know that our students do have the capacity and have to make the decision to move forward with treatment or resources. That's not something we can put on them as a university, right? Or as a group. And that's hard when you're worried about people. And so I think that is also something that we have experienced with faculty and staff. So I think, again, providing some space, talking about the resources and how they can help, reminding folks that those resources can help, and then providing a little support for our staff who are in distress at the time. Like, what is happening? Do you have the resources you need? So there's a little bit of both with that. With respect to the caregiver stress and just feeling concerned about everyone all the time, I think that's where I agree, Madison. Self-care means different things to different folks. And coming from, I was born in Sri Lanka, and coming from a family where you make decisions based on how everybody else may consider that situation, self-care is broader for folks. So it might be helping staff figure out what supports do they have. That could be someone at work that they're close to. It could be just going to lunch or taking a walk, eating lunch outside, 10 minutes of not talking about work. If they don't have that resource, or what is the thing that you haven't been doing that you used to do? We talk to students about that all the time, and now it's become more of a where's our check-in? It's almost mid-semester, and it's on my list to check in with folks of, okay, what's that thing that we said we were going to do this semester for our energy? And maybe that's a better way to think about it, is where's our energy coming from, and what else can we tap into? And I'm not saying that they're always there, but there may be just connection with other people and an ability to validate that there is no great answer for this situation, whatever that may be for them. And also talking to students and staff about how did they get here? So how did they go through this past year and a half to the place where they're at now? What's keeping them going? And that might look like this. It might be in waves, but there are likely some pieces of their community, their faith, their exercise, being outside, animals, right? Dogs that people got over the pandemic. What are the things that maybe they can reconnect with in terms of moving forward and continuing to move forward? Because I think with caregiver stress, can feel very stuck in the muck of the worry. And I'll stop there and let other folks jump in.
Yeah, I agree with everything you just spoke, Shivani. I think, and I also want to kind of echo something that Maddie said earlier about creating community, and whether that's creating community in the workplace or encouraging sort of a reconnection of community outside of the workplace. I think, that's something that I've observed across the board in terms of a struggle on the employee side of things. By necessity, we've had to distance ourselves. And even this discussion is being held in a virtual space. And that's a different kind of energy that we're spending. And it's a different kind of social engagement. And so those among us that really feed off of social energy and that sense of community, are suffering in a different way. And it is not the same to engage on a Zoom call. It just isn't. And so, you know, are there some opportunities to safely engage in person, or if not, then what is a healthy alternative that you can engage with that sort of, again, rebuilds your energy? I think another aspect of the conversation is you know, encouraging people to reconnect with their sense of purpose and keep track of the times when things are going well. Is there anything that you can point to that you're grateful for? That, you know, having a sense of gratitude, even in the presence of stress, it doesn't take away the stress, it doesn't cancel it out, and it doesn't make it any less stressful. And it's really important to also keep in mind the good things. So that's an example of that cognitive flexibility that we're talking about. It's not all bad or all good, it's both and hopefully we can find a balance point. So being able to have that conversation with folks sometimes can help them sort of recenter themselves around what keeps me coming back here and doing this work, and you know, what is it that I actually am missing that I need, and where can I find that? I think those are really important conversations to be having.
I think something else that comes up for me in working with students is the idea of secondary trauma. And when we are in these student-facing roles, we are kind of in, like Shivani said, this caregiver role. And, you know, especially, this is a panel full of women and majority women of color. And so that is not lost on me that predominantly women of color, women fall into this caregiver role. And there is an emotional labor that is attached to not only a lot of our jobs, taking care of students, making sure they have resources, what do they need, what are their worries, what happened in class, etc. And taking on all of that can be re-traumatizing for us as staff members, and not everyone shows that in the same way. So I think it's really important to be cognizant of the way that our colleagues show that distress. For me personally, I have a delayed reaction. I will react to something bad that happened way later. Like, I'm totally fine in the moment, crisis, got it, awesome. And then like a few hours later, I'm like, shut down. What just happened? Now I'm in crisis. So I think that's really important to see, to connect with colleagues and our coworkers and make sure we know how they're showing up, where they are. And also something that is just really key for me is making sure that there is humor in what we're doing. If there's a day that I'm not laughing, that's a bad day. We need to be laughing, especially as, at least in my family, my community, Indigenous people, we've been through some really heavy stuff, but we're the funniest people you will ever meet. I guarantee it. Because we find the humor in these terrible things. It might be dark humor, but we're still going to laugh about it, and we're going to find a way to joke about it. And I think that's really a key part of resilience, especially in communities of color.
Awesome, definitely. No, I think you all hit on some really great points. And the only thing I wanted to add in addition to all of this is really what I created last year out of hurting, out of the pain and out of the rage that I personally had. I created healing spaces, virtual healing spaces for our campus community. And so this was just a way for us to engage with one another, for us to be able to take a collective breath. We did some breath work and some meditation. For those of us specifically people of color, specifically Black people who were being murdered, and it was televised as a camaraderie. It was really important for me to host safe spaces for us to focus on the reconciliation and the healing process. So to focus on being an active ally, to focus on engaging with one another and building in that community, to have hope, to choose joy, to practice gratitude, but most importantly, just to be with other people who get it, right? Other people who understand the multitude of types of oppression that you're facing, the systemic, the overt, the covert, and just being able to have a safe space for healing was really, really important, especially during this time. I mean, we're truly in unprecedented times. And so it's important for us to find ways in which we can focus on the healing and restoration. March 13th of 2020 was the day that changed my life. That was the day that Brianna Taylor was murdered in her sleep. And she's my very namesake. She's just 3 years younger than I was, and we both share purple as our favorite color. And so this was very traumatizing for me, to be honest. It was very alarming for me. I couldn't sleep for weeks, knowing that my very namesake, her life was taken away just because of her identity, which is my identity. And so it's just understanding that we needed these spaces where our rage was welcome, our worries, our sadness, some of us just got on there and we were silent. Our numbness is welcome sometimes as well. So being cognizant to not ask for, those people of color to always be the champions, always be at the forefront, always giving, their advice or their support. Sometimes we need support as well. And so I think that is important. This is where we have the opportunity for our allies to become active, right? Go past the performative of, just putting out a statement, but actually doing the work. I think that's really important to support each other and to really cultivate an environment of inclusive excellence. And then the last piece that I'll say is just extend grace to yourself and other people. Extend grace to all. We all are deserving of grace. I think that is really important, especially now. There will be challenging days, and we're currently in challenging days, right? The pandemic hasn't ended. The racial injustice hasn't ended. We see what just happened to our brothers and sisters in the Haitian community and at the border in Texas. So these systems of historic racism and oppression are still impacting us, right? COVID is still impacting us. And some communities are even more marginalized than others. So just being cognizant of all of that and really just holding space and giving grace to yourself and others.
Again, thank you to everyone for sharing those really profound insights on what some of the struggles have been for people who are in that sort of caretaker role here as faculty and staff. And, really kind of that overarching takeaway of showing kindness. I really appreciated, Brianna, how you kind of framed doing the work in terms of learning about trauma-informed approaches and how that can be part of doing the work as well to show that support and how that can take us beyond performative pieces, especially when we're talking about racial justice and just, really, really appreciating these ideas of how we can support one another, because faculty and staff certainly need that support too. We are so much of what creates this experience for one another, for ourselves and for our students. And so we certainly need that kindness and that love that we so often want to and do extend to our students. Kind of going off of what Brianna was mentioning, I think this connects really well to the last question that I have for our panelists. We're going to start with Brianna, and then of course inviting everyone else to chime in. When we reflect on the past year, racial justice has been at the center of many of our conversations here at the university, which also means that racial trauma may have simultaneously occupied those spaces and those conversations. So if you could briefly share a little bit more about what racial trauma is and the ways that you have observed racial trauma influencing the experiences of everyone that populates our community. So that would be students, staff, and faculty, just from your observations. And then, of course, opening it up to other folks.
Sure, this is an excellent question, and thank you, Sophia, for this. So racial trauma is simply perpetuated exposure to racism over an extended period of time. So this can be systemic. So these policies and practices and procedures that very institutions are built upon, right? Looking at the school to prison pipeline, things like that, that give you constant exposure to systemic racism. So both overt and covert racism as well. So experiencing the microaggressions and the implicit biases, going through opportunities where you're a victim of discrimination or racism or even violence. I think that's important to acknowledge here as well. And so all of those collectively, that is what the racial trauma is. And it's also important, one piece that we haven't really hit on yet that I wanted to make sure to share is the historical perspective of racial trauma as well. So we have to think about our indigenous ancestors, about our American descendants of slavery, who founded this very nation, but we were in captivity, right, because of white supremacy and oppression. So we have to be cognizant of that, that we really have a historical perspective of why people are, feeling hypervigilant all the time, or why people are stressed out all the time, or why we have what's called racial battle fatigue. And that's really just an extension of being exposed to racism constantly. And so that is something that we have to, once again, be cognizant of and focus on the healing process. And I think that it's important to note that healing is a part of justice, and justice has to be mentioned in the healing process because justice is a way to love out loud. So if you love out loud, you're showing that you care, that other people matter, that other people's voices matter, that other people deserve to share and to live, right? The Black Lives Matter movement isn't specifically about a person or an individual. It's about being able to live and to breathe and to walk in my Black body, knowing that I'm safe. So I think that is important to be cognizant of that and understanding that people are often oppressed because of our very salient identities. So we have to be cognizant of that as well. Last year, I was actually a victim of police brutality by the Columbus Police Department for the first time ever. And I had a group of my students and we were downtown Columbus. I simply had a sign that said Brianna Taylor, justice for Brianna Taylor. And we were about 50 feet from Congresswoman Joyce Beatty, and we were all tear gassed and sprayed with the rubber bullets, and they had the horses out, and it was a very traumatic experience, but I knew that I had to do something. I knew that I couldn't be silent. And so that is when I became just a champion for change, an advocate. I had to say, no more, this ends with me, this ends with us. And we have to truly do the work to come together to make sure that these events that we see happening, that we stand up and speak out against them. As I've mentioned, Brianna Taylor, I would also be remiss if I didn't give honor and acknowledgement to Julius Darius Jones. I actually just got back from Oklahoma last month, and Julius Darius Jones is an innocent Black male on death row. He has served 22 years on death row for a crime that he did not commit. And I've been working with the family for the past year and a half. And I just went to Oklahoma to meet them in person. Long story short, he had a commutation hearing. They voted 3-1 in his favor to release him, or grant his commutation, but the governor said no. So he's set to be executed November 18th. So now, literally around the clock, I'm still working with these people to help advocate and amplify his voice so that we can actually get a stay, so that he is not executed. He is an innocent man. He's just a victim of this system. And so I think it's important to be cognizant of that. The work is never ending. It's still happening. And we have to really do what we can to fight for justice. As Dr. King told us, injustice anywhere is a threat to justice everywhere. So the one charge that I would have for everyone today is to go to justiceforjuliusjones.com and to sign the petition, to share it on social media, just to amplify his voice. I think it's really important to acknowledge that we're talking about racial trauma as in Sometimes it's in the past, but sometimes it's also what we're currently facing. And it's also current events that are happening. So we just need to really be cognizant of that and think about our students, getting back to, the very reason why we're here, our students. What about our students that are social activists? And what about our students that have, lost loved ones to, police brutality? So what about our students who have been victims of police brutality? I spoke to a student in the union, and she said a police officer asked her for 3 forms of identification. 3 forms of identification. I don't even own 3 forms of identification. So just being a victim of racial profiling, even on our very campus. So just being cognizant that these things still happen. And so this is why sometimes there's the hesitancy or resilience or hesitancy to even come on campus. A lot of our students don't feel safe on our campus because of the racial injustices that we've been experiencing. So it's just important to be cognizant of that in our respective positions so that we can use our agency to really create change and really demystify and dismantle these systems of oppression and really do what we can do each day to create change.
Yeah, I just want to echo what Brianna is talking about related to stepping outside of performative allyship. I think a lot of people, and I've seen this manifesting over the last 18 months or more, particularly as more and more violence has been sort of front and center on the news. Racial injustice has been occurring for a lot longer than it's been a hashtag. And I think the more people are becoming very aware of it, that's a really good first step. Awareness is really key. And a lot of people are starting to feel very overwhelmed with the weight of the problem and just how complex it is and how intertwined it is in our system. And so that can lead to some paralysis around, how can I do anything to make a difference? And so the impulse then is to step away and do nothing. When in reality, it's very, very important to do something. So being able to acknowledge that whereas you might not be the single person that's gonna solve the problem, that every step in the right direction is a step in the right direction. And even if you can't do everything, it's really important to do something. And so sort of circling back to a look at ourselves and our own value system and taking a look at, what is it realistically possible for me to contribute in this space? And it may be on the micro level, it may be on a meso level, it may be on a macro advocacy, change the system level. But wherever your lane is in terms of being a support, it's really important to occupy space in that lane. So I think that's just something to throw out there, that you don't have to do everything, but it is our responsibility to do some things.
Thank you. I know that we're running a little low on time and we have some questions in the Q&A. That was such a big topic for us to end on, and certainly starting the conversation rather than starting and ending. But really want to thank Brianna for giving us so much in terms of experience, personal experience, and then the experience of some of our students and staff from last year, thinking about racial injustice, thinking about racial trauma, thinking about some of our student populations. I think so many of our populations folks who identify as people of color sort of across the board have been so impacted by the pandemic, these health inequities, right? We've seen, and then we've seen the racial injustice attached to police brutality, which Brianna shared with us. And then we've also seen the racialization of this virus itself and the impact on Asian Pacific Islander, Desi American individuals who have been brutally attacked verbally and physically because of the pandemic. Many of those people are our colleagues and our students here on campus, and that racialization continues to this day for all of our communities. And so being aware of that, kind of taking that first step with this conversation for some of us, or continuing that journey for others of us. Just want to thank you for bringing that into the space. We do have a few questions in the chat and in the Q&A that I would love to address with the panelists. So I'm going to read the first one. In the Q&A, staff are continuously creating those spaces, as Brianna and Madison mentioned, for our students, faculty, and other staff in terms of being able, I believe, here to connect with one another and connect with faculty and staff as well. When you're the person creating those spaces for students to connect, how do you find spaces to release your compassion fatigue and address your emotional battle fatigue? So I think this question is asking how we can create those alternative spaces to address those issues as staff members. So I want to open that up to the panel.
That's a great question. And I think it's truly about just being open and honest and vulnerable. I believe in the power of leading with vulnerability. And I believe that that also opens up the space for others to feel safe and to feel, hey, I can share my story now because I heard from Bree. I think we need to cultivate this environment of support and inclusion, and by whatever that means, right? We have to understand that people are going to come to these safe spaces raging, right? People might come crying, people might come silently and not even have the words, but just want to be in the community because they're oftentimes othered, right? They're the only one in their space or in their setting, and so they want to be, to Madison's point, in the vicinity of community to really engage in this work. And so one thing that I really pride ourselves on with these safe spaces is, like I said at the beginning, having a collective breath, truly, focusing on our breath work, finding a moment for mindfulness and meditation, and a moment to just be. Also focusing on positive affirmations, I am enough, I am worthy, I do matter. Those things are very important to say, but also to affirm to one another as well.
Yeah, I think speaking to that idea of, creating some space that is held for the caregiver or the person who's offering support to others, I think if you build it, folks will come. And so sometimes it's just a matter of saying out loud, hey, wouldn't it be great if we had an hour once a month that we could chat about these things, and putting it on some calendars to invite some folks to come. It's not always easy to find common time, and especially when we're mission driven to support others. I think being able to frame it for ourselves as this is necessary maintenance, and that we're not going to be able to provide our best work and our best support to other people if we're not in good working order ourselves. So this isn't optional. And I think if you find yourself in a space that's lacking that support, sometimes it takes that courage and vulnerability that Brianna was talking about to say, hey, I need this. Who else? And getting it built.
Thank you so much for that. I'm going to move to our next question, which I think is a good one and is probably on many folks' minds. How can we apply these approaches to dealing with distressed students or colleagues without trying to assume that there's trauma? How can we apply these strategies to distress and sort of stay in our lane as faculty, staff who are not mental health practitioners?
That's a great question. So I think a lot of the information from today can provide, I'm hoping, a framework of understanding. There was a slide around being empathic, right? And being able to step in someone's shoes. And that is a very curative piece for someone to have. So just being able to sit with them and then understanding what the resources are and being able to get someone to the resources and provide some hope. Those are things that are all part of mental health first aid that can be really helpful for a student. So you're still providing care, though you're not providing mental health intervention, information, support, and hope is super helpful.
I would also add that I think we sometimes want to label things, right? So that we can know what we're dealing with. But the label of trauma, the concept of trauma is really from within, and that label should not be applied to other folks, and it should be on individuals to label that themselves because it's their own experiences. We are experts in our own experiences and no one else's really. And so I think that's a really key piece in that concept of empathy and not making assumptions about where people are coming from, because like Ariana said in the presentation, like trauma can be experienced in very different ways, and what may be traumatizing for someone might not be traumatizing for someone else. And so not making assumptions, making sure that there is space for people to explore how they want to be, how they want to label themselves or share what their own experiences are.
Thank you so much for that. Really great advice, and really love what you said, Maddie, about it's trauma, that identifying piece comes from within. That's so empowering, because I think a lot of times, as many of you all shared already, it can be such a stigmatizing label for reasons that don't have to do with our experience, right, and who we are. So thank you for affirming that for us. We are just about at time. The last question in the chat, which is something that we can certainly send along afterwards, asks about resources to help with cognitive flexibility. So I will certainly connect with our panelists and see if we can send along to participants those resources. We are at time. This was such an open and, for me personally, very affirming and healing conversation to hear the insights of our panelists, to hear the presentation from Ariana. Thank you so much to each and every one of you for being here and for sharing this space with us, and for sharing essentially part of yourself and your expertise with us. So appreciated, so grateful. And thank you to everybody here for the comments that you put in the chat, for the questions that you asked. Thank you for being a part of this with us. Please do consider taking this out into your spaces, right? Whether you want to try it at home first and then bring it to work, wonderful. If you want to take it straight to work, great. But please do take this with you, carry it with you. Even if you have to think about it for a week, a month, a year, keep it with you, keep it close by. It will serve you in some way, at least we hope it will. So thank you very much. If you have any questions, feel free to reach out to me. I know that our panelists said that they're comfortable with folks reaching out to them afterwards as well. And I hope everyone stays safe and has a wonderful evening and a wonderful rest of their week. Thank you. Bye-bye.